Good evening, everyone. This is Dr. Alfonso Vega from Southern Philippines Medical Center. I'm here to talk about retinopathy of prematurity based on our experience from a tertiary center in Mindanao. And I'd also like to present one or two cases regarding the use of intravitreal anti-VEGF for retinopathy of prematurity. Just to give you an overview of how many deliveries the hospital handles, I have here data from the Institute of Maternal and Fetal Medicine detailing the number of live births that were delivered in the institution for the past 3 years. 2019 saw about 17,000 deliveries, and there was a drop in the corresponding years, presumably due to the effect of the pandemic. Deliveries were about 11,000 for both 2020 and 2021. With regards to neonatal complications in the center, here we have a tally of the total number of preterm births that were delivered in the hospital. In 2019, we saw about 944, and there was also a corresponding drop to the number of preterm births in the center, again due to the pandemic, at about 540 and 619 in the next 2 years after. This data was garnered from the annual census annual report of the Department of Pediatrics section of Neonatal Medicine. This is from our own Department of Ophthalmology annual report, wherein we detailed the number of babies or neonates that are screened for retinopathy of prematurity in the past 3 years. In 2019, we saw 244. In 2020, we saw about 269 and about 300 in 2021. Here I'd like to highlight the rates of ROP compared to the number of screened babies that we saw. During the period of 2019 to 2021, we saw a 3-year ROP incidence of about 5.9%. This is a significant difference when compared to the rates of ROP incidence in the Metro Manila area of about 15%. This number was again derived from the consensus statement of the PPS, PSNBM, and the PAO ROP working group, which was published in the Philippine Journal of Ophthalmology, August 2020. These are the rates of the patients that had RP that had requirements to do LIO and intravitreal injections. In 2019, we saw 7 for LIO, 2025, and then 2021, 3. For intravitreal injections, as you can see from the chart, there's 2019, we saw 5, and then 11 for 2020, and about 6 for 2021. Some more statistics for the viewers here. The rates of ROP requiring treatment compared to the live births are relatively low for the past 3 years because of the sheer number of deliveries that are being performed in the center. The rates of ROP requiring treatment compared to the ones that were born premature, relatively higher, although I have no data to compare this to. This is the risk factor breakdown of the ones that were screened for ROP, and as you can see here, there's a big significance of oxygen exposure to the ones that develop ROP. Also noted here, there are about 17 patients. The next most significant risk factor, it appears to be, would be no risk factors at all, and I wonder how this can be explained. Moving on to the case presentation. Here we have AG, a newborn female from Toril, Davao City. She was born to a G2P2 27-year-old mother via normal spontaneous vaginal delivery, cephalic in presentation. No complications were encountered during the delivery. Her birth weight was about 1.62 kilos. The APGAR was 8 and 9. Ballard was 31 weeks. Postnatal age was 4 weeks and 3 days upon examination, and the postconceptional age was 35 weeks and 5 days. The current weight now is 1.52 kilograms. In the course for the NICU admission, she was treated for sepsis, and there was a history of exposure to CPAP oxygen for 4 days. The maternal history was positive for COVID, and the prenatal checkups were done at the health center. The patient is non-hypertensive and also non-diabetic. The gross and an anterior segment examination appear to be unremarkable. The fundus examination for the right eye revealed clear media with normal cup to disc ratios. The vessels were noted to be tortuous and dilated, ending at what appears to be zone 1. A demarcation line was also seen from 4 to 5 o'clock, with the presence of dot blot hemorrhages on the distal inferior arcade, on the vessels of the distal inferior arcade from 6 to 8 o'clock. On the left eye, you see CDR, a normal cup to disc ratio, and tortuous and dilated vessels were also observed on all the arcades, ending at zone 1. There was no identifiable elevated ridge, and no exudates or hemorrhages were seen. The impression at this point was aggressive posterior ROP, zone 1 for both eyes. The plan was decided to be intravitreal injections to be given for both eyes. Here's the follow-up of the patient 1 month post anti-VEGF treatment. Here you see for the right eye, you notice clear media and a normal cup to disc ratio. The two demarcation lines are also still evident at this point at 10 to 11 and 7 to 8 o'clock, although there appears to be a resolution of the hemorrhages. On the left eye, you see normal cup to disc ratios and clear media, with a ridge observed from 11 to 7 o'clock, and beginning detachment seen at zone 3 posterior from 11 to 7 o'clock. The plan at that point was to do another dose of anti-VEGF injection for the left eye. In the interim, the regular fundus examination was done. 3 months post anti-VEGF, and here for the right eye you see normal cup to disc ratios again with clear media, and then the two demarcation lines that were seen at 10 to 11 and 7 to 8 o'clock appear to be regressing at this point for the right. As for the left, again with clear media and normal cup to disc ratios, there's a noted persistence of the ridge with beginning detachment at zone 3 posterior from 11 to 7 o'clock. So it seems like the eye is still status quo. The plan again at this point was to do our third dose of anti-VEGF. And the patient now is awaiting follow-up for the left eye in particular. In another case, we have YC, a newborn female from Tugbok, Davao City. She was born to a G5P3 33-year-old mother via breech. No complications were encountered during the delivery, and the birth weight was 1.49 kilos. APGAR was 6 and 7, with a Ballard of 31 weeks. Postnatal age was 3 weeks and 6 days. Post-conceptual age was 34 weeks and 6 days. Current weight is 1.52 kilos. The course in the NICU was remarkable only for RDS, and there was a history of exposure to MEC vent for 5 days. The mother is also a confirmed COVID-19 case with regular prenatal checkups done at the health center. She was a non-hypertensive, also a non-diabetic. The anterior segment examination appears to be normal. Moving on to the fundus exam. For the right eye, you note clear media and normal cup to disc ratios. There's also a noted tortuous and dilated vessels ending at zone 2 with a circumferential demarcation line seen. For the left eye, you also note tortuous and dilated vessels on all arcades ending at zone 2. There was no identifiable elevated ridge. No hemorrhages and exudates were seen on both eyes. The impression at this point for this particular patient was aggressive ROP, posterior ROP, zone 2, bilateral. The plan again was to do intravitreal injections of anti-VEGF for both eyes. Here's the patient's fundus 1 week post anti-VEGF. You note clear media with normal cup to disc ratios. The vessel tortuosity and dilation was also decreasing. It was noted to extend, the vessels were also noted to extend to zone 2 posterior. The circumferential demarcation line was also noted to be regressing. For the left eye, you also note decreasing vessel tortuosity and dilation, as well as the extension of the vessels to posterior zone 2. And the plan at this point was for weekly monitoring. In the interim, the regular fundus examination was done. There was note of progressive decrease in tortuosity, and the demarcation line was not appreciated in both eyes on the next few follow-ups. Here's the patient 1 month post anti-VEGF. On the right, you note that the vessels now extend to zone 3 posterior and that no demarcation line can be seen. No exudates and hemorrhages were also noted for this patient. For the left eye, you note again the extension of the vessels to the posterior zone 3, and there was no observation of any demarcation line, exudates, or hemorrhages for both eyes. The plan at this point was again now to try to extend monitoring to every 2 weeks. Now you ask yourself, the patients both had similar clinical profiles and the same treatment courses. You often ask yourself why it always leads to different outcomes, which I think the next lecture would try to explain. That is all for us. Thank you.